This is Dr. Pranam Chandra. Today I will be discussing about diabetes mellitus. What is diabetes mellitus means? That is the Greek or Latin. It is both. Diabetes word derived from Greek and mellitus is derived from Latin. Diabetes by meaning in Greek means to pass through, where the patient here passes urine. So it is passing more amount of urine. That is the word meaning of diabetes. Whereas mellitus is in Latin means honey, which is sweet. So if you tell only diabetes, it means any condition in a person passes more amount of urine. That is diabetes. Whereas so there can be multiple types of diabetes. If you want to know, there are diabetes mellitus, which is the most commonly we call diabetes by convention. Diabetes by convention means diabetes mellitus. Other types of diabetes are diabetes insipidus and phosphate diabetes. These are also type of diabetes. Whereas in diabetes mellitus, that means the passing excess of honey, that means sweet, which is the most common disease around. Coming to types of diabetes mellitus, we finished with diabetes. Now coming to types of diabetes mellitus. Diabetes mellitus, there are multiple types actually. The main two which we commonly see in general population is type 1 and type 2. Type 1 initially thought to be occurs only in young children or adolescent age group, whereas type 2 initially thought of which occurs in elderly people. So initially type 1 is called as juvenile diabetes, whereas type 2 is called as adult onset diabetes mellitus. However, now we know that type 1 can occur in elderly and middle-aged people, and type 2 can occur in adolescent and children age group. So nowadays we know no more we call it as juvenile or adult type. Now we call type 1 or type 2. Another term which was used initially was insulin dependent or non-insulin dependent. Once again, this term has to be discouraged because non-insulin dependent, which is usually referred to type 2, there you need to give insulin also in the course of the disease. So it creates a lot of confusion. So now, as of now we are sticking to type 1 or type 2 diabetes mellitus. And apart from classification of diabetes mellitus, brief to differentiate type 1 or type 2 diabetes mellitus. Type 1 is actually absolute lack of insulin. Is usually autoimmune disease. Autoimmune disease means where the body cells fights its own other body type cells. So it will be destroying the pancreas. The pancreas actually beta cells which produce insulin, they will be targeted for destruction, and this patient will have absolute deficiency of insulin. Whereas in type 2 it is more of a insulin resistant. Insulin is there, the hormone which actually acts needed for our blood glucose metabolism, but it is not acting, it is not effective. The action for the end result, it is posing a resistance. It is insulin resistant. The resistance to insulin action occurs in type 2 diabetes mellitus, whereas in type 1 it is absolute lack of deficiency. Because of this, we have a separate groups of type 1 and type 2 diabetes mellitus patients who are present in a different clinical features because of their by virtue of their pathology. Pathology is entirely different. Here absolute deficiency, here it is excess of insulin, and insulin is insulin is not acting. That's a problem. So these are the main type. Other types are like gestation life limits, that is some pregnant ladies are more prone to develop diabetes mellitus only during pregnancy. That's a gestational life limit that we call type 4, and others are some autoimmune disease, some drug induced, some viral infection induced, some genetic disorders like MODY, which onset diabetes in young. There are multiple types of, but what public has to know is type 1 or type 2. Whenever you see a patient, you decide whether this patient is a type 1 patient or this patient is a type 2 patient. That's more important. That's all about the classification of diabetes. Then I will be dealing with the symptoms later on in the next video.